Hey everyone, it's Dr. Hillary. It's Tuesday and we're going to do our Q&A with the little spinny wheel. So I've got some that everyone submitted, and if you submitted some just recently, I'm sorry I didn't get to them. It's been a busy day, but we got some questions to go through. And let's see what we have. So remember, you guys are submitting these questions early, and then I'll read it out loud. You don't have to be present to win. Just watch this later and you'll see if I announced your name and then your spinny wheel. So I'm going to try to start doing more of them like gift cards, because mailing them every week, there's a lot of things for me to mail out. So I'm getting a little irritated by that, but I'm happy that you guys are winning. So I'm going to try to do some more type things. Jennifer Norris wants to know, how do I know which bones need adjusting? I think she's asking, how do I personally know, not her, but how do I know what bones need to be adjusted? So what I rely on mostly is my what's called palpation. Like my fingers touching, I can tell when the bones are crooked. And you might think like, well, I can't tell that. How would Dr. Hillary be able to tell that? Years of practice and training. There's literally classes in chiropractic school called palpation classes. And it's exactly what you think. We just laid around and like felt people's spines and what was normal and what was abnormal. And the teacher would come by and the ladies would be in gowns, which was quite annoying, let me tell you, to put a gown on for hours. And they'd be like, see this bone's crooked. Then everyone would come over and press on it and touch it and see how it's crooked. And you really got your like sense of touch like really honed in. In fact, you could practice by putting like pieces of hair between like sheets in the Bible and like seeing where it was, like getting your sense of like touch like really honed in. So good question, Jennifer. So I use mostly sense of touch. Then there's also what we call like different muscle tests, where you might notice someone that like I might push on different muscles and check your leg length, and because that will tell me like what areas are tight and how it's misaligned. So there's a whole bunch of like little party tricks that we do. And chiropractors are famous for looking at leg length. So if you're ever laying on a table and I'm like, hey, your right leg's shorter than your left, that's an indication that there's a misalignment in the pelvis or the sacrum. So that's like a clue to us as to what's going on, and then we go from there. So good question, Jennifer. Let me turn this so you can see my spinny wheel, and let's see what you win today. Oh, nothing. Just kidding. We'll just respin it. Okay, you are going to win a yoga class. Awesome. I will get this sent to you, and I'll reach out to you and get this to you. So congratulations, and thank you for doing that. One thought that I had is, anyone that wins something, I would love if you like have a picture of you with it or doing it, or what you purchased with, let's say, the Amazon gift card, or just make a note like, hey, this is what I got for my win. If you could post it in this group, the Wellness with Dr. Hillary, that would be just great to see. I always wonder like what people buy, or like the Starbucks gift card, like what did you get to drink? You know, maybe it'll be something that I like too. All right, next question. Oh, Sa asks, would 2 pillows contribute to neck pain? I guess it depends on the pillow. So if you're stacking 2 pillows, if they're really thin, maybe, maybe not. If it's 2 really thick ones, then definitely yes, because you don't want your head to be like angled up. So from a side view, you wouldn't want it to be angled up because of the pillows. For some men or women too, with like larger shoulders, like broader shoulders, you might need 2 pillows for a side sleeper. So it depends on the person, but I always offer my patients to bring in their pillows, and I'll just do a complimentary like check on the pillows to see like if it's the right size for you. One time I have a lady that brought like 2 garbage bags full, and she had like 6 pillows, and I was able to find 2 out of the 6 that were still good, and I was like, throw the rest away. All right, you also have another kind of similar question. It says, how often should the mattress be changed? I think it depends on the mattress company. But if you start waking up achy, you might notice that like, hey, I've had this mattress for 6 to 10 years, and that could be a contributing factor. Let's say you go to a hotel room and you're like, this is the best sleep ever. They have a lot nicer mattresses than some of us. And yes, that could be contributing. Make sure that you rotate the mattress. Some of them allow you to flip of them, but I've noticed a lot lately that you just rotate them. I know we got a new mattress last year, and we don't flip them anymore. You just rotate them. So good question on the mattress. A follow-up question, I know you didn't ask, but people often ask me, well, what type of mattress. I don't really have a specific brand that I like. In fact, I don't love the one that I bought last year after all my research. So maybe you shouldn't trust me. But in general, you want to have a medium to medium firm. And then I've heard good things about the Sleep Number ones because you can make it more firm. So that's an idea for you. But if it's too soft and your butt sags into it, that really creates a lot of like strain on your spine and compresses the lower part of the spine. So the soft, like fluffy type ones can sometimes be a hindrance to back. So let's see what you are going to win. You are going to win a $5 gift card that I bought from Healthy Happies in Carmel. This is the place that you guys have seen. I used to I had a gift tab open there for a while of $100 for anyone to go in and use it. I assume it's all used up by now. I haven't heard, but thank you again. Maybe go there and take a picture and post it in here of what drink you got. Next question. Karen wants to know what kind of chiropractic care would be good for athletes with pain. So there are a lot of adjustments that we can do for athletes. So with my athletes and young athletes too, I tend to look a lot at like the ankle, the knee, the hip, because they're often running a lot and like moving in different directions. And then, for instance, I've been telling a lot of my teens, let's say they play on Saturdays. It might be good to get adjusted the week prior to the game or the tournament on Saturday, and then also that Monday after, because I can get you lined up for the game. The thing about getting adjusted before a game or an activity is that it will prevent you from getting injured. So that I feel is key for our athletes, young and old, is the prevention aspect of getting adjusted. But then I know everyone goes, well, I want to feel good when I'm done, or I want to make sure I'm lined up afterwards. Then you could do a Monday after. But I'm always concerned with like the prevention aspect, because if an athlete is running, let's say, and their ankle's out of alignment, that's going to set them up for an ankle injury or a knee injury or a trip and fall, and it's just going to like keep going. So I really strongly encourage chiropractic care for athletes, whether or not they feel like they're in pain. Think of it more like injury prevention. And the younger kids need it, because when you're young, you don't have that pain sense as much as an adult. Whereas we might say like, oh yeah, we woke up stiff and achy and this hurts. They might say, no, I feel fine. Their brain just doesn't register it the same as we. So it's best if they just come in and we just check them and say like, hey, this is out of place. Let's align this, that type of thing. And so we do offer even like kids weeks at our office where we do a discounted adjustment for kids and a free exam, and that goes from ages 0 to 12. So if we have some of our preteen athletes, that would be great. It's great for anyone, but just anyone out there listening, definitely chiropractic care for athletes is a must. In fact, that's actually what I started when I started going to chiropractor. I remember when I was playing tennis and like moving side to side, I would get my pelvis all out of alignment, and it was pretty painful. So I remember. So let me spin the wheel, Karen, and let's see what you got. Karen, I'm going to Venmo you some money. So I hope you have Venmo. If you don't, we're going to figure out another way so I can get it. So, and then comment or take a picture of what you bought with the money, just so we can kind of see all the fun stuff. I've given away hundreds and hundreds of dollars over the past 4 weeks in different prizes, and I would love to see what you guys do with it. It's exciting. I love giving away things, and I love seeing people happy. So I appreciate you guys putting in questions. We will do this again. And always reach out to me if you have any questions or how I can help. If this sparked an interest in you and like, hey, maybe my kid needs chiropractic care, or I wake up stiff and achy and my neck's not feeling good and the pillow's not helping, that's a time for chiropractic care, and I would love to do like a consult. So reach out to me, and I hope you guys have a fabulous day.